Welcome to the NSCHBC Edge Podcast, leading the way in the business of medicine. Now here's your host, Terry Fletcher.
Hello, everyone, and welcome to the NSCHBC Edge Podcast. I'm your host, Terry Fletcher. The Edge Podcast is brought to you today by the National Society of Certified Healthcare Business Consultants. Our goal is to discuss healthy business principles, have conversations on the business side of medicine, so that you and your practice can thrive and be profitable and successful for years to come. As many of you know, the NSCHBC is a proactive organization with over 300 members, including legacy members that share their wealth of knowledge and expertise with each other, whether it be in the legal field, accounting field, revenue cycle management field, the business management field. We have value-based care and more. We have every kind of consultant that focuses on healthcare in the industry you could want. So for this episode, I'm happy to welcome back fellow NSCHBC member and healthcare consultant, Vinny Sankaran. I hope I pronounced that right. CEO of Medical Billing Wholesalers. So welcome to the podcast, Vinny.
Thank you, Terry. That was great.
Yeah, so no, it's good to have you back. Vinny and I were on one before where we had another guest, and actually it's been so long I forgot who it was.
That was Misty.
Yeah, oh, that's right. That we were talking about revenue cycle management and everything. But today, we're actually going to get into a topic that is, I think it's kind of one of the hot topics right now in healthcare, and that's AI. You know, artificial intelligence and just dealing with a lot of the implementation issues, the safety issues, but also the positives. And, you know, we have to look at both sides, you know, the potential and the risks. And I know you're one of the subject matter experts as you've, dove into this topic. And so here we go. I just want to see, where we're at and what you think about it and what everyone can expect. The first thing I just want to put out there, as much as I think a lot of us hate change. I don't know if you noticed about that, but we kind of hate change. But the AI age is here to stay. You can't stop technology from happening. I mean, I miss my BlackBerry when we had to switch to iPhones and Androids, and I was happy to get rid of the brick computer, and now we've got the flat screens. But there's things that I've been in this industry so long. I remember the fax machines that had rolling paper on the ground when we walked in the office in the morning. But now we have so much technology that we kind of are running into a brick wall without having oversight to start. It seems like they kind of jump into it and then say, oh, wow, we don't have safeguards. We have some risk here. We have machines making decisions where if the information is input terrible, then it's going to come out terrible. So I wanted to talk to you about that and just kind of start off with, let's be positive to start. Some of the pros. I'm hearing that data really suggests out there that AI does actually help health providers to practice their profession. It will help them with some time issues instead of all the administrative work. How do you feel about that just as a first glance?
Perfect. Thank you, Terry. Like you said, AI is the hot topic now, and change is difficult for everybody. But having said that, this is happening just like the internet happened, and we had emails, so this is definitely happening. And a lot of unknowns in this, like you said, there are pros and cons to everything. Same with the internet, right? We didn't know, and it took us many, many years to find out that, the internet has its positives, but also has a lot of downsides. AI is pretty much the same. And because it's so big, it is exponential and it's really fast moving. It's not slow. So let's talk about the positives and then we'll talk about the risks. So NSCHBC in January, we had a panel talk about AI and we gave some demonstrations just with regular, chat GPT and a few other things, just for basic things like emails and things like that. And just gave ideas of how it can help practices, hospitals, and a variety of things. One is in diagnostic, and we'll come to that for a second, but you started talking about administration. So a lot of things AI can actually be like your assistant, a virtual assistant per se. And a lot of doctors complain, especially in the revenue cycle, when we talk to doctors, they say, I see patients for 8 hours and then I spend another 2-3 hours just doing the paperwork, meaning administrative stuff, updating the codes, filling out the stuff in the EMR before I can leave for the day. So AI can definitely help with a lot of that. And if AI can do that and be trained to do that, then it frees up more time for the doctors to engage with patients. And that is another a complaint for patients, right? It's not, they don't get as much time. The doctor talks to them for 2 minutes and they're busy looking at their screen and typing as the patients are sitting in the room. So we are hoping that, AI can actually, that'll be one of the big positives.
Well, one of the things that I noticed when we moved to EMR from paper charts is that we were hoping that that was going to free up some time for physicians, but it seemed like as soon as they found an electronic workaround, they just added more patients. So I'm not seeing that the providers will actually take advantage of this from a time saving to put back into patients. It's almost like a time saving to add more patients and add more, just because more patients means more revenue. What is your response to that?
I have to agree a little on that, but I think this will be a little different than EMR. So what happened is EMR, they promised a lot of things, right? Every EMR will talk to each other. It's going to be seamless, and that never happened. Obviously, we know that, right? So let's not talk about that. That could be a whole podcast. In
Right.
this case, I think it'll actually help a little
Mm-hmm.
because, yes, if it frees up a lot of the time, they're going to add patients. I'm not going to refute that, definitely. But I'm saying when the patient is sitting with a doctor, instead of them having to type stuff into the EMR, some of them use scribes, and AI can replace the scribes and actually take notes and populate a lot of EMR when you're with the patient. So instead of spending 2 minutes with the patient, they spend looking at the patient maybe for 10 minutes. Because don't forget, for coding and purposes, they still have to spend so much time with the patient so they can code and document everything. So that part, they can't add more patients. That's my feeling. Again, only time will say. So I'm hoping it'll help a little. Will they add more patients if they save more time? Absolutely. So, for example, if the doctor is spending 2 hours after 5 p.m. doing documentation and they free them up, they're going to extend their time to maybe 6 and add another 3, 4 patients. That's definitely possible. I think it'll be a bit of both.
Right. One thing I notice in the practices that I have currently that are using AI already and they're kind of relying on the companies that they purchase the software from, that they've implemented their own safeguards. They've taken out some biases or some, they call them hallucinations, where you're putting in ruptured appendix and it comes out ruptured Achilles or something, and they're not really reviewing the notes after it happens. That concerns me. Does that concern anyone that you've been talking to on the AI platforms?
Yes. So AI has been used in a lot of different things. And I agree with you 100%. That's one of the topics we talked about, hallucinations. We still don't know how and why it hallucinates. We know it is going to hallucinate, and they're trying their best to reduce the hallucination. See, but if you force it to reduce hallucination, then it misses out on a lot of stuff. So they're trying to find the right balance. And I think you still need a human in the loop, at least for the first few years. Maybe it's a decade. I don't have the exact time, but you can't just trust what this AI system spits out 100%. Do you want to do 100% quality check? Do you want to do random checks? But you need a person to check the stuff. It could be your office manager. It could be somebody on your billing side if you're talking more about coding or something that has to do with billing. Or if you're talking about just clinical notes, maybe somebody in the office looks at it, maybe an NP, a PA, your office manager if they're qualified. But I don't think you can just take what it is. And in the conference, we actually gave live examples of how it happened. And it sometimes the system gives you stuff that is totally false.
Right, right. Well, you know what it reminds me of a little bit, and this is probably simplifying things, but it reminds me of when I'm texting and it
Mhm.
tries to put in a word for me, and I'm like, that's
Mm.
not what I said. And I don't look and make sure that who I'm sending my text to got the right, and I look at it and I'm mortified because I'm like, I didn't mean to say that, sorry. And it kind of thought before me, and I was like, oh shoot, that person's not going to be happy with that text.
That is a great analogy. I didn't think of that, Terry. 100%. I don't like autocorrect, but it is useful now and then. But if you don't check what you send, I've sent messages that are completely different from what I wanted to type, and it
Right.
happens till date. And this is a technology that's been there for what, like 7, 10 years now, the
Yeah,
autocorrect.
forever. And you're just like, that's not what I
It's
meant to
still,
say.
it always thought that. Forget when I try to use some words from a different language. I'm talking about just English. It still messes up, I would say, at least 20% of the time.
Right.
And again, you want to check before you do. Luckily, with Apple that I use, there's an edit one. So every day, even today, I did it 3 times. I sent something, it got it wrong. I had to click edit and correct my message. So I'm guessing with AI, it's the same thing. But so let's say it takes you an hour to write the notes for, I don't know, 25 patients. Maybe it's only going to take you 10 minutes or 15 minutes to review the stuff and make some corrections. But somebody has to do it, either the doctor themselves or an NPPA, like I said, an office manager. This is
Yeah, I would
definitely
recommend a clinician if it's clinical. You have to have
correct,
somebody who's got
correct,
clinical
correct.
experience or background. So here's something that I worry about, and not just cyber attacks and things like that, but I worry about breaches in privacy. So they have to get this information from somewhere, and obviously the learning process must be from patient charts and existing records. And I know there's been some hospitals out there that have, you know, without vetting them first, they've had their EMRs and certain systems where they have like an internal, I don't want to say a third party spy, but something in there where, let's say you come in to an orthopedic practice and everything is done for you, and the doctor determined that you needed to have some kind of support brace, and then all of a sudden on the patient's phone, in their emails, everywhere, they're getting all of these marketing texts or whatever saying you need this. And my concern is that this information flow is the privacy issue. Are these AI systems, do they have to be HIPAA compliant? Are they considered to be a HIPAA entity?
No, they're not. So I
Oh,
am
wow.
working with, I'm fine tuning a few things. So let's talk about OpenAI, which is ChatGPT, pretty
Okay.
common. Then I'll talk about Gemini, which is part of Google. It used to be called Bard. They changed it
Right.
to Gemini. So OpenAI, they actually signed a BA finally. They didn't do it. This literally happened a couple of weeks ago. You have to justify the reason you need it, what the data you're using. So let me pull back a little, right? LLMs, which are large language models, they have thrown everything at it. All the data in the world has been thrown. So there's a lot of garbage in it, good stuff. So that's how it is, right? So when you try to take a model out and fine tune it, OpenAI, for example, says they do not use your data to further train their system because they've already trained whatever they need to. So you need to open it separately, meaning you can't just use the free model. That is definitely not HIPAA compliant. You need a paid model. Then you have to have an API and you have to train the model on your own data. And then you can justify and they will sign a BA with you. It becomes HIPAA compliant. And that data is not used to further train other models, their model. So that's the only way. That's an open AI. Similarly, Gemini also just said that they're going to sign BAA. Again, there are criteria you need to do. You have to have a Google Workspace. You have to justify why you need a BA, what you're going to use the data for. Do you have authority to use the data? A lot of things. And then they sign a BA. So I'm working with Gemini currently as we speak. With OpenAI, I have a BA signed. So it is the whole process. And a lot of people are asking these questions for the right reasons. But like you said, a lot of people have already played with it and done it. Do they have a BA? Do they understand HIPAA? Do they understand the cybersecurity risks? I'm not sure. I'm sure everybody knows what happened with Change Healthcare. So,
Yeah. Well, it's just funny because, and you and I hate to say we're amused at some things, but some things out there, I'm sure you and I face plant and bang our heads against the wall sometimes, even when we hear some of our politicians saying things like, remember during the pandemic, everyone was like, are you vaccinated? Are you vaccinated? That was like the big question. And we'd have politicians standing on the steps of a Capitol saying, you can't ask me that, that's a HIPAA violation. And you and I are like, not if just the next person next to you asks that question. It's rude, and you can say it's none of your business. But
yes,
unless you're a HIPAA entity, it's not a HIPAA violation. So,
correct. Like you and me can talk. That's fine. We are friends. We can talk
right.
about health, and that's not a HIPAA
Yeah.
violation
So
because
I worry about the security risks here because, AI can only learn from data, and that data has patient information, even though I'm sure, we'll see now I'm making an assumption that it's redacted, but is it really? I mean, because you have to have patient, demographic, you have to have the age and the situation, and any comorbidity. And just, you have to have so much profile information. Could you figure out who that patient is? And that concerns me. That really does.
That is true. Still too early, Terry. I'm pretty sure there's some, because if you talk about PHI, right, people think only name, date of birth, maybe social security, but there are 20 different items, right? And
Yeah.
include genetics, driver's license. There are like 20 different IT that come under PHI. So even if they redact maybe the name, like I said, age and social security, I'm sure there are a bunch of other things when they're doing. Again, this is very new. People are trying to see an experiment. So I'm pretty sure they're not following all the HIPAA violations now. And when going back to cyber securities, uh, everybody's using AI, right? It's not only healthcare is one part. Hackers are using AI, I'm sure, to find and exploit vulnerabilities. And I'm guessing, we'll have to also use AI to see where we have issues so we can kind of plug the breaches, open ports, any vulnerabilities we have, we should be able to look and use AI to at least help us get a start saying, hey, these are what the hackers are going to use anyway. So maybe we go there. So there's a lot of things.
It's funny because on one side of it, it's kind of scary, and on the other side, I almost feel like I'm a movie producer creating, something cool, because you go on LinkedIn now and you go to post something that you think your followers will find interesting, and LinkedIn says, "Would you like AI to rewrite it for you?" And so a couple times I'm like, "Well, sure, let's see how they look," and I'm like, "Wow, I wish I said it that way." And other times I'm
Yes,
like, "No, I like the way I said it better." Even like Instagram, a lot of social media now, it's like, "Do you
mm,
want AI to do it for you?" Um, but then I
that is
see,
true.
yeah, then I see some. It's like I have a couple clients that have started AI. They adopted a software within their Epic system. It seems like everything always comes back to Epic, since that was like the first EMR anybody started with. But they're in testing. They have not. They said, we have not full blown done it. We've just testing it on part of our practice. I'm like, thank God. They said, because we are, concerned that it's not ready yet. But the one thing that I think is, I don't want to call it counterproductive. I'm not knowing the word, but I think providers sometimes forget that a medical record is their account of the patient, not a machine created account, not an AI account. And sometimes these records look like somebody from Harvard generated them, not the physician who's in there with the patient, talking to the patient, having a conversation, doing a live exam. It just seems like it's a cited referenced paper. And to me, that doesn't have as much value as an actual face to face, you know, encounter with the patient. And I know that digitally, and I mean, we've gone from paper charts to EMR, and that was necessary. I mean, I've been in this
Mm,
so long. I remember holding paper up to the light and going, "Can I read this?" And I don't have to do that anymore for the most part. Sometimes of
that's good.
hospital
Yeah.
records, but for the most part. So, I mean, and you and I talked about this offline. I work probably 90% remotely. So digitally, I need what's happening with electronically, but I still, and maybe this is just still old school, I'm not sure, but it just concerns me that everything is going to be taken over by machines, and the personal touch, or the physician specific to patient information is going to be so genericized, if that's a way to put it. It's just going to be so, textbook. It's going to sound like an encyclopedia. It's not going to be real.
Mm. I hear what you're saying, Terry, and there is definitely a possibility that'll happen, like you just said, right? So I use ChatGPT a lot to rewrite some stuff. So give it an article and tell it to summarize. And as long as you do the prompts, that's the whole thing. This is called prompt engineering now. So if you write the prompts correctly and ask it to deliver, let's say, give me 7 bullet points of this article, it does a great job. 9 out of 10 times. Again, you still have to read it. Same thing. If you ask AI to summarize your interaction with the patient, and if it sounds like it's from a Harvard Business Review kind of stuff, you'll have to rewrite it. But there are ways you can tell it, write it in a humorous way, a more like a lively way. There are a few prompts you can use that it will not be so rigid. And when you play with it, you understand. But again, it depends on the doctor, right? How much time they're willing to into it. You have to train the model. It's just like a dictation software. The first time I speak, it picks up, let's say, 7 out of 10 words. You got to train it, say, hey, this is how I pronounce this word, this word. And as you train it, it understands you as a person. Same thing with AI. Will the doctors put in the effort it needs to understand who you are a person, how you write notes, and it can take how you do it and kind of replicate it. So the goal is for it to assist you, not replace you.
Not replaced you. Kind
And,
of like
right?
telehealth. It's a good supplement to in person, but not to replace it.
Correct, correct.
Yeah.
Telehealth, like you said, can help, but you don't want to say, I'm not never going to meet the patients. I'm only going to do it by phone.
Yeah,
I
that's
don't think that's
silly.
the best
Yeah, you
idea.
can't you
Right.
can't palpate a mass over the phone, you know, you just can't do it.
Correct.
Well, it's interesting because as I'm, looking at all this, nothing has zero risk to it. Everything has risk to it. So trying to get to zero is just not going to happen. But like you were saying, that we're trying to have to figure out the best way to mitigate or remove those risks,
Mhm.
or not invite risks, if you will, like especially not reviewing your information or assuming that everything is correct. I do like the prompt thing, that's helpful, but really understanding that it's still in healthcare, it's still the provider's note, and it has to be reviewed. It has, we were talking about in another podcast today, just where I'm seeing a lot of disclaimers where doctors are saying basically excuse any errors, and if there's errors in prescribing meds and giving this, it's not my fault because the computer did it. I'm just like, that doesn't work. You can't do that anymore. That does not mitigate your responsibility. You still have to, you're signing off on the note, so you're saying it's accurate.
Correct. I mean, that started out using in emails, right? If there's a typo, excuse me, because it was dictated, that's okay. That's not that big a liability. But when it comes to something a doctor is prescribing, I don't think just writing the disclaimer is going to help them. I'm pretty sure their malpractice insurance is not going to agree.
Yeah, no, that's definitely not going to be there. One thing I wanted to ask you, a lot of practices feel that the company that they use, that they're adopting their AI, either software download to their EMR, or if they're getting new information, that they're the ones that have to have the compliance plan or compliance policies. Do you agree that, or I should say, do you have a comment? I know this is my belief, is that I think the office has to have their own policies.
Correct.
Okay, they have to have their own compliance plan, what they would do if there is a problem, if there is a mistake. Plus, and you and I know this, I don't know how far you get into coding, but one of the things on coding is you can code based on medical decision making or time in the
Mm,
office. But if you're not the one putting in the time, a machine is, you don't get to count that time. And so it's clear in the record and in the published guidance. And a lot of people are like, well, wait, I'm still giving that information, so shouldn't I be able to claim the time? Like, but you're not generating it. So it's hard to get that. There's so many gray areas right now.
100%. Let me just talk about the compliance that you mentioned. For example, let's go back, leave AI for a second, just EMR companies, right? So they have data. Responsible, obviously, on the high tech and HIPAA on their side. That doesn't mean the doctors don't have to be compliant. Similarly, in AI, the company that is supplying has to have all their regulations, for data breaches, cybersecurity, all that. But the doctors also have to do the same, right? They can't say, by the way, I paid this company, vendor ABC, to help me with AI, so I don't have to do anything. It doesn't work that way. So it's everybody has to be, because when a breach can happen, it can happen anywhere, right? It could start as high as change, but it can happen at the billing company's level. It could happen at the doctor's level. It could happen anywhere, right? And that's pretty much the same thing. And in terms of coding, what you said, I agree 100%, unless they change the what it means in terms of time, that you can have, computer assisted is also part of the time. But right now, like you said, that's not how it's written. So I don't know how they're going to read it. I'm sure the doctors are going to say, I paid for the software, it's helping me, so
Yeah,
it's part of
no.
the time I spent. I understand their argument, but I don't make the laws.
Yeah, it's that's not appropriate right now. Well, it's so interesting because we're talking AI in healthcare, and it stems everywhere. It's fun to use. It's fun to practice with it and mess with it. The one thing, oh, I know I was going to mention to you. I don't know if you've ever gone on WebMD, but this is so
Mhm.
funny. They have AI, and so if somebody's, so many people use Dr. Google. It's really sad, but we do. Everybody does. They're like, okay, this hurts. Let me see what's wrong with me. And I probably wouldn't go to Google. I'd probably go to WebMD instead, but they've got some up there. And what they've trained their AI to do, and I guess this is coming, is to be empathetic, which I think is pretty funny
Mm.
because they showed a contrast where they had several physicians that responded to concerns with patients. One splashed grease in her eye, one had a dog bite, things like that. And the
Mm.
physician's response to, in my opinion, was kind of not cold, but very kind of abrupt. Do this, and if it doesn't work, go to the ER. And the AI response was like, I'm really sorry that happened to you. This is what I would do, and don't forget this. And again,
Wow.
don't be concerned and calm down. It was just so empathetic. And I'm like, I liked AI better on that scenario. So,
I did not check that out. My wife actually used to work for WebMD, so I know them. She was on the market research side, but I
yeah,
haven't seen their website in a couple of years. So I saw that somewhere else. Maybe there was an article I read about empathy for AI, which is actually, like you said, it's great. And at a time when people are asking WebMD for advice, emotion definitely helps, empathy
it
definitely
does.
helps. So, you could say the same thing, just in a nicer, softer way.
Just, yeah,
It'll
yeah.
go way, way better. Yes, I like that. I will definitely test it out.
Yeah, it's pretty. It was kind of interesting, especially for people that are concerned with just accidents at home, or
Mm,
I missed
mhm.
taking one of my pills, or just something like that. It's just kind of interesting to see the empathetic side when you're thinking this is just a machine. It's not like the Terminator.
Oh, well,
It actually can assist in other ways. So,
that's
I
awesome.
yeah, I appreciate you, giving us the pros and cons. Again, everyone, this is here to stay. We're definitely not going to anytime soon see this put back in the genie back in the bottle. We're just not. It is so,
Oh,
keep
no.
yeah, keep updated, make sure that you are listening to these types of not just podcasts, but find your webinars and your education on that, and look at what HHS is doing. They're trying to get some safeguards, and hopefully, it's going to continue to improve and get better and be a little more safety forward. So, Vinny, I'd like to thank you to being our guest today on the podcast.
Thank you so much, Teddy. And yeah, a lot of things are going to happen in AI. So just keep watching. And every conference at least has one section just dedicated to AI. I'm talking only in healthcare, and it's just going to get bigger. So
It is.
watch the
Yeah,
space. Thank you so
great.
much, Teddy.
You bet. To find and contact Vinny, you can go to the NSCHBC website at nschbc.org and click on Find a Consultant. Type in his first name, Vinny, and his information will appear. Also, as a reminder, the nschbc.org website offers monthly free webinars on a variety of topics, as well as a quarterly Medicare regulatory update. Please go to nschbc.org and click on the tab Upcoming Education. You don't want to miss some of our great topics we have, not just for through 2024 and into 2025. Also, there's space left to attend our annual conference. Again, go to nschbc.org to register. That's it for us today, everyone. Make it a great day, a great rest of your month, and thank you for listening to the award-winning NSCHBC Edge podcast. I'm your host, Terry Fletcher.
Thank you for listening to the NSCHBC Edge podcast. Join us on the second Tuesday of each month as our consultants tackle the complexities of navigating the business of medicine. You can reach us on the web at nschbc.org, the National Society of Certified Healthcare Business Consultants.